524 of you voted on a poll recently. I asked you, on a scale of 1 to 5, how stressed do you feel at work? 63% of you said most of the time or every day. Now, why are you doing this to yourself? Listen up as I tell you the 5 least stressful nursing jobs there are out there on the market. Some research and in my own personal opinion, these are the 5 least stressful nursing jobs there are out there on the market. And I will be giving these to you in no particular order. So let's start with number 1. Number 1 is telehealth nursing. This type of nursing is done through the telephone, video conference, or an email. This position is relatively flexible, which keeps this job a low-stress nursing job. And you're not having in-person to in-person interaction for this job, which relieves a lot of stress for some people. When I worked in an outpatient center, I remember watching the med tech do Zoom calls with people, and I think the most stressful part of that position was trying to teach people how to open up a Zoom call, honestly. That's what seemed the most stressful about that position. Moving on to number 2, that would be a school nurse. School nurses, of course, are working in schools all around the nation, and you have set hours, Monday to Friday, no holidays, no weekends, because you are not at school when the kids are not at school. These nurses provide children their daily medications. They are providing PRN medications, as needed medications is what PRN stands for. They are also providing BLS care, and they help in education for health class. I remember back to elementary school being in this terribly old, moldy school building. But beyond that, I was lined up with all my classmates outside of the nurse's office, and you would go in one by one and you would sit in this old wooden chair, like from ages ago, with that big light over your head, and they checked you for lice. That is my remembrance of our school nurse. And also, I might have taken a few naps here and there at the nurse's office when I didn't feel like being in class. But all in all, being a school nurse is relatively low stress compared to a lot of other nursing positions. Number 3 would be a home health nurse. And home health nursing has wonderful flexibility. My mom is a nurse and was contracted to do a home health gig, and I remember her hours were amazing on top of her pay. You can get paid a lot of money to be a home health nurse. She was taking care of one person at a time. That's it. So no more racing around the clock like you do for bedside nursing, trying to juggle 5 patients. She had one patient helping with ADLs, but not cooking, not cleaning, although she did help with the cat litter box. Other than that, she was helping getting dressed, bathed, all of that type of stuff. But no cooking, no cleaning, so it wasn't like she was a maid. Home health nurses also help with medications. You can go into the home and provide those medications for those pediatric patients you're taking care of or those adult patients you're taking care of. A really close friend of mine has home health nurses coming to her house for her daughter, and it's just so rewarding to have that one-on-one patient care, it seems, and also it's wonderful for those parents if you do take care of a pediatric patient, because you know you're lightening their load when they are at home. Now, if you don't want to leave the hospital, maybe this next one is for you. And this would be number 4, and that would be a lactation consulting nurse. Now, if you have children, you might know what I'm talking about, but if you don't have children, you might not have any idea what this type of nursing is. These nurses specialize in the clinical management of lactation and breastfeeding. These nurses help the patient understand the positions of breastfeeding, how to have the baby latch to the breast, and also make sure the baby is getting enough breast milk. They do much more of that, and there is a lot of education that also comes with this type of nursing. Not only do these nurses work in hospitals, they also can work in birthing centers, public clinics, and even pediatric offices. And finally, let's get to number 5, and I personally have experience working in this. That would be an outpatient infusion center. I worked in an outpatient transplant infusion center and clinic. And let me tell you guys, this was the least stressful nursing job I have ever done. I would have 1 patient, maybe 2 patients at a time, get their vital signs, put their IV sites in, hang their medication. When the medication was done, I would take their vital signs again, take the IV out, and they would just walk on their way. There was no assessing. There was no racing around the clock, it felt like, although you would have patient after patient after patient come in for their infusions, and some patients come in late, which would kind of back it up a little bit. But that was the stressful part about the job. There was no, oh my word, let me try to juggle 5 patients at a time anymore. There are so many types of infusion centers out there. Mine was a very tiny clinic that I worked at. We had maybe 6 rooms for infusions on top of the clinic rooms, but there are huge clinics out there, huge infusion centers out there. Those might be a little bit more stressful if you are looking into this type of nursing. So those are my top 5 least stressful nursing jobs. Which one of these 5 would you choose to work in if you left bedside nursing or left your current nursing position? Would you be a telehealth nurse? Would you be a school nurse? Would you be a lactation consultant nurse? Would you be an outpatient transplant or infusion center nurse? Or would you be a home health nurse? Comment below which one you would choose if you left your position today. I would love to hear your opinion. Other than that, that is it for today's video. Thank you for tuning in. Do not forget to subscribe to my channel right now and hit that notification bell as well so you are alerted when new videos are posting. Other than that, see you later guys. Have a wonderful week and I'll see you in the next video.